you have a patient who is being mobilized and or on SBT or on any kind of weaning mode that is there, and the patient gets tired in any way of whatever it is, gets tired and the SBT fails, or for that matter TP styles fails, or for that matter pressure support trial fails, whatever fails. If something fails on that matter, especially after the patient gets tired, it's important what kind of mode will you apply. Tell me, what kind of mode you apply?
For pressure support.
No, so never you apply pressure support. You have to take care of the patient. You have to take care. So for that matter, the only mode that will give complete rest is going to be volume control mode. Okay. So in this case, what I will do, if I put pressure support, what is going to happen? I'll show you. Okay, if you put pressure support, and I space this pressure support on, lagao, pressure support lagao. So when you put pressure support here, and I start it, you still are going to have very large tidal volumes probably, which indicates huge swings in pressures. Okay, have you applied?
Yes, sir.
Okay. Now see, you have the pressure supported mode here, alarms, okay, and you see there's a big swing, very high tidal volumes. Immediately it has come. Okay, you have very high tidal volumes that come in the moment you start pressure support mode, because the patient is breathing very heavily, very heavily. So in this case, what you need to do, very high dips in negative pressure. So the only thing you can do in this case is first go to IPPV, that is full support. Give a good amount of tidal volume, which is adequate for this patient, matlab 6 to 8 ml per kilogram. So if this patient is 70 kilos, 7 8s are 56, so I'll give 450 ml. 450, this is not ARDS patient, so 6 ml per kilogram is max, up to 8 is maximum. So I want to give good minute ventilation so that he gets rested. I'll see my I ratio, I touch every button on the ventilator, give I ratio of 2, 1:2 I have given. I've kept the RR so that the minute ventilation is good enough. So the minute ventilation here will be 6 4 24 5 6 7, at least 11 liters. Okay, and now I'm giving a good tidal volume and a peak that is slightly high. Usually what happens when a patient gets tired, the next thing that happens is the lower lobe starts collapsing, and that's why you give a slightly higher peak. Okay, so maybe I'll give a peak of around 8, and we'll wait and watch as of now. Okay, FiO2 as per the saturation shows 100% there, and see that BP is high because patient was struggling. In some time that BP will come down. Don't worry about the next step would be looking at the EtCO2. Okay, if the EtCO2 goes markedly down, then reduce the tidal volume first. Reduce the tidal volume first, then reduce the frequency. Okay, that's going to be the plan. Okay, look at the EtCO2 for some time, and then you decide this further, and do this for at least 1 to 2 hours. If when it's doing prolonged TP styles, do it like this. Do not put on pressure support mode. Do not go back on TP styles. Wait for him to settle down. Okay?